Okay, so I think this is a really important point right here, that a voice coach might be permitted to use touch-based cueing. Let me give you an example of touch-based cueing. If, as a coach or a professional, you feel that a person's forward head is part of the problem, all right? And as a manual therapist, my intervention might be something like, I'm going to hold you here, and I'm going to stretch you, and I'm going to release those muscles and the fascia, and I'm going to do exercises to get you to stay back here. That's viewed by many as the mechanism of action is viewed very, very different than if someone came in and said, get your chin back. Right? You just touch to give that cue. And traditionally, in historic models, they're very different interventions, right? Because when I do manual therapy, I'm reorganizing tissues. I'm correcting tissue faults. Whereas in touch-based cueing, you're just giving a behavioral cue. And there's this big wall between those two. But when you really start looking at the evidence from manual therapy on why it creates change, it's less about what we're doing to the tissues, and it's more about what we're providing up here. Sensory input, alteration in motor output. And I'm not giving an unlicensed person permission to do this work, right? You have to make those decisions on your own. But what I'm just trying to say is maybe there's less of a difference between sustained manual therapy and what happens to a person's central nervous system when we give them a cue, all right? So that even if you didn't provide prolonged stretching, maybe it's just a little bit of sensory input starts the process of change.